Good morning, Congressman Emmer. It's a pleasure to meet you. My name is Konstantinos Lazaridis. I'm a physician scientist and the incoming director of the Center for Individualized Medicine at Mayo Clinic. I would like to thank you for your time to meet with me to discuss this morning the Personalized Medicine Caucus. To start our discussion, I want to share with you that my own journey in individualized medicine started about 2 decades ago, when I was fascinated about the Human Genome Project and all the promise. And I took a sabbatical at that time to work with Dr. Francis Collins at the NIH with the idea to bring this expertise back to the Mayo Clinic to benefit our patients. So this is where I come from, and I'm very grateful for all the work we do in that particular space. And so I'd like to know, tell us about why you decided to launch the Personalized Medicine Caucus.
I want to thank you for doing this today and for being in it for 2 decades. I have not, but what's interesting is my tie to this and the reason I'm involved in it, unbeknownst to me, started 2 decades ago when I lost my sister from breast cancer. You know, I remember when the family goes through it, you know, nobody thinks about it, right? Until you have someone, either you personally or you have a close family member or friend who deals with a terminal disease, a terrible disease, then you realize how many other people have had this challenge and how many other families have gone through it. And the good fortune I have being in Congress and being involved in policy gave me the opportunity to be part of the Personalized Medicine Caucus. And now, obviously, I'm a co-chair of the Personalized Medicine Caucus. I just imagine this is the next generation. If the treatments that are available today, my sister passed of breast cancer in 2000, if the treatments that have been developed since were available back then, maybe she would have lived another 10 years or maybe even lived another 20 years. She'd still be with us. But now you think about what we're working on in the next generation, where you could literally be able to identify the genetic makeup that would be predisposing her to breast cancer. And you might be able to treat that before she ever experiences the disease. Quality of life, preservation of life, more importantly, think about the dollars it will save society.
I cannot agree with you more. I have my own experiences in my own family about cancer, and I know what you're talking about. I understand it. And at the same time, that's what drove some of us within the center to have now studies where we screen individuals for breast cancer. And I can tell you, we have started a large project, which is very scalable to our practice. And we have identified people who have predisposition to rare forms of breast cancer, and they're very young and they don't know about it. And actually, half of the people we found to be positive for those predispositions, they have no family history, no personal history. So you imagine what you say, it's a reality, and imagine how this discovery can change those people's life, the life of their family, and how this will make a better future for all of us.
Right. And I mean, this goes to a whole bunch of diseases. Obviously, we're talking about just cancer, but think about things like ALS, think about other mental health issues, MS potentially, heart disease. There are so many different things, diabetes.
Yeah, absolutely right. I agree with you. So in your opinion, Congressman, what are the most significant shortcomings of a one-size-fits-all healthcare system that we have? And how do you think personalized medicine can help us overcome those challenges?
As I get into this, and I'm smiling, Dr. Lazaridis, because this is something that falls in the wheelhouse of a Republican. But guess what? It is not a partisan issue. Republicans and Democrats really tend to get along very well in this area because we realize, despite the fact that one party traditionally believes that government provides the best solutions, the other party believes it's individuals that provide the best solutions. In reality, as you know, as a practitioner, the best solutions are somewhere in between, right? But we all recognize when we're talking about a one-size-fits-all healthcare system that government-managed solutions that, in that respect, are very inefficient. And ultimately, they're a lot more costly in the long run. I mean, we've already built up a massive national debt that will inevitably be passed on to future generations. And bloated government healthcare will only exacerbate this problem, which is why it is imperative that we promote competition in the marketplace, because without medical innovation, without competition, medical innovation tends to suffer. And look, most Americans like their private or employer-sponsored health insurance plans. And again, government-managed healthcare tends to limit the freedom of choice that the individual gets. And I co-sponsored the Personalized Care Act, which expands health savings account through increased contribution limits and tax penalty reductions for withdrawals. I've also co-signed a letter in support of Medicare Advantage, which serves nearly 50% of all Medicare beneficiaries in Minnesota. And I believe personalized medicine will address these shortcomings in unlimited ways. Earlier detection of disease can save exorbitant costs on the back end. Prevention, obviously, is always cheaper than treating the disease, which we kind of touched on with our experience with cancer. And it's a more effective option, obviously, than reacting. And a breakthrough in personalized medicine, I believe, would also lead to revitalized medical innovation and competition in not only the United States, but around the world. Granted, in my opinion, America is a world leader in medical innovation due to the competition that our system promotes. And we could open the door to a whole new era of innovation with this personalized medicine that you and your colleagues are moving forward on.
Thank you. Thank you for your thoughts. So from a public policy standpoint, what do you think is the most important thing that can be done to help advance personalized medicine?
Well, I think you'd agree with me when I say that I believe we need to start by breaking down barriers to new early stage treatments and therapies. For example, pharmacogenomics, which I always screw up, why don't we just call it PGX, is an area that we've been working on in this personalized medicine caucus. And I believe it's a viable path to explore. 99% of the population has a genetic variant that impacts how their body will respond to a pharmaceutical drug. And more than 91% of the population is just not able to process medications in the way that that medication is intended because of the way their body reacts. Every person's unique genetic makeup affects drug efficacy, absorption rate, dosage, and all. And as a result, overall patient safety can be compromised, right? PGX can provide the information that a clinician needs, which will enable improved decision-making when it comes to these different things regarding these prescription medications. Although numerous studies, have demonstrated just how critical PGX is to patient care, it's not yet broadly accepted in our healthcare system. And I think that's where we've got to break that down so clinicians can have more certainty in how to use PGX, and we don't need to enlist pharmacists in the effort to determine the best medications to prescribe. I think that's where we would start.
I agree with you. I mean, it's an important topic, and we have all of us to make it easier for the practitioners to be able to apply this knowledge. The knowledge is there. The other thing that strikes with me is that if you're not tested, you don't know. I have my own personal experience. I was tested on a panel of pharmacogenomics a few years ago as part of an educational project, and I found that I have a very rare variant that if I expose to a particular common medication, I may have a life-threatening event, and I never knew about that. So, and I'm not alone. There are many people around us, as you stated. The vast majority of us metabolize things differently. Everybody is different, and at the same time, the same. And so, how we find a way to be able to make this possible, that will save lives, will save cost, will improve the care of our patients. And so whatever you can do in this bipartisan effort to make this possible, to bring this knowledge to the public, to facilitate the process, I think that will be very, very important for our patients.
Doctor, I tell you what, this is why the caucus exists. I listen to you and I think about you because we started out by saying, what's the biggest challenge? Well, we've got to break down barriers. We've got to find new ways to get this into the system. Imagine you were lucky because of a project. But imagine if, we're all told to go in at 40 years old because you got to have your 40-year-old physical, right? There's a lot of people who think they're just superhuman up until they're in their late 30s, and now they got to start paying attention to certain things that maybe they haven't paid attention to before. Could you imagine if that 40-year-old physical or that 35-year-old physical, or maybe even earlier, also involves the type of testing that would be necessary to identify this stuff? And I would say the younger, the better, because as you continue to move forward in this area, imagine how much money, not just pain and anguish, anxiety that the patient and the patient's family and friends experience, the community loses productivity from that person while they're trying to recover, if they're able to recover. But imagine the dollars if we're going to put aside all of our emotional blessings that we would get from this type of innovation and advancement. Think about the money that will be saved in the healthcare system, which ultimately, look, you want to be efficient. You want to make sure that it's treating the issue and or curing the issue. And you want to make sure that these people that are dealing with whatever the disease is, that they can be productive members of society and have a certain quality of life, and that we can reduce cost for everybody in the system.
Yes. So in your opinion, what does Congress need to do to facilitate personalized medicine? What are going to be the next steps?
Well, remember, we all work for you. But your employees in Congress, I like to refer to myself as a customer service representative for the U.S. Congress. Your customer service representative, your representative, can only be as valuable as the information and input you provide. So I would say the first thing that needs to happen is we have to continue hearing from stakeholders like you about what it is you're working on, so that we know. And by the way, you're the one with the personal experience in your circle that's trying to move forward. You got to let people like me know, the policymakers, hey, we have a barrier to this. We're running into a problem with this agency or with this insurance definition, and tell us where those barriers are so that we can be more valuable to you in your mission to innovate and create and, frankly, pursue better lives for the patients that ultimately you're going to treat. That'll allow us to help you continue to innovate. It's that bureaucratic red tape. And look, we can all use loaded terms. Bureaucrats tend to take a lot of criticism, but they're good people. They're just doing the job that is in front of them, and they may not understand. But because they don't understand, they create that red tape that can stifle innovation in the administration of care. So if we know, we can actually help try to reduce those barriers, reduce that friction of you or other entrepreneurs and innovators that are working directly with an agency of government to move forward. And then I think it's just a matter of we need to gather more evidence-based data to educate the public, not just the public employee sphere, but the public in general on the benefits of personalized medicine. And it's too exciting, as you know, Dr. Lazaridis, when you start talking to families. I have a colleague here in Congress, not exactly related, but he's elected to Congress, and within a matter of weeks, he's diagnosed with kidney cancer. It was because of a breakthrough innovation, which allowed the treatment to boost his immune system to attack the cancer, that he's with us today. And quite frankly, has a positive result in terms of his future. So you just got to keep doing what you're doing. You have to keep educating us so that we can do our part in making sure that you can accomplish what it is you set off to do. Because at the end of the day, this personalized medicine, this is, and I love the fact that you say much of this is already here, but okay, it's the future. The future's now. Let's make sure it's as big and bright as it can be.
We physicians, practitioners, people who are the early adopters in that particular space of medicine, we are very excited because we see that there is significant growth day by day to what we're doing. I mean, to me, where we are today was inconceivable even 5 years ago, not talking about 20 years ago. And so we have so much to offer, and we have to find better ways of how we can deliver this back to the public. And this is where we need your partnership, and we do. to be able to say, those are the challenges we're facing. We have some solutions. We don't have every solution, but we can make things better. And so let's work together to make this possible. So with this note, thank you for your time, Congressman Emmer. I appreciate all the work you do. We're very grateful.
Thank you, Dr. Lazaridis.
Thank you.
Thanks for having me.
Thank you so much.